Group C.
دكتور جروب سي اسمك.
Group B.
ايه دكتور نسمعك.
Group A. Group
نعم
A.
دكتور نسمعك.
هسه باوربوينت موجود. السلام عليكم. In this lecture we speak about the surgical instrument used for surgical procedures. First, surgical handpiece. This is surgical handpiece. This surgical handpiece used when the tooth is fractured and dissection by this instrument. This instrument need not go the air inside the soft tissue cause emphysema. This surgical handpiece we can connect it with dental chair or
صوت نويز مزعج كلش.
يعني اكو صدى.
مو صدى دكتور بس اكو هيك خشخشه ما اعرف شنو.
هسه زين هسه. This is surgical handpiece. This surgical handpiece used for dissection of the tooth during the tooth extraction. يعني we can do normal extraction, but during this normal extraction, the tooth became fractured. If the tooth became fractured, need dissection by surgical handpiece, then remove the tooth. This surgical handpiece, we can connect it with dental chair or connect it with a portable machine. Must be sterilized. Why we use the surgical handpiece? Because if use turbine for dissection of the tooth, lead to air go inside the soft tissue, lead to emphysema. يعني contraindication dissection of tooth by turbine. Must be used surgical handpiece. Must be used surgical handpiece. First, second, surgical handpiece by and use it need many bears. This is bear. Bear used for removal of the bone must be fissure or round for smoothing the bone or cutting, dissect the tooth. This is surgical bear. This bear long, this is fissure, and this is round. Scalpel and blade. This is blade holder and this is blade. The most common used for surgery is number 3. This is number 3, and we have different type of blades. For example, this is we have number 11 and number 12 and number 15. Each of them it has special use. For example, the most common used is number 15, which is used for flap and incision on the edentulous area, and number 12 for incision in the gingival sulcus and incision in the posterior teeth, especially in maxillary tuberosity region. And number 11 use it for incision on the abscess area, just by penetration in the abscess, the pus discharged. The most common use, this is blade holder, and this is we have different type of blades, number 11, number 12, and number 15. The most common used in our clinic in oral surgery this is number 15. Number 15. And how can you put the blade on blade holder? The blade is placed on blade holder by mosquito or needle holder. This is mosquito, which is slide into the slot receiver by bevelet. And the correct position to put the blade by mosquito or blade holder, not by hand. You put the blade on blade holder by hand. This is wrong. Sometimes you injure your hand. And also remove the blade from blade holder by mosquito or by needle holder. This is the correct position during the incision, like pen. How can you grasp the pen? The scalpel is held in pen grasp and cut edge faces the surface of the skin or mucosa that is be inside it. Like, how can you grasp the pen? Similar, you can grasp the blade holder. This is. And periostal other instrument, periostal elevator. There are many type of periostal elevator. The most common used 9-volt, which has two-ended. One end pointed end used for elevating interdental papilla. This is the sharp end, and other end which is for elevating the mucoperiosteum on the bone. The periostal elevator used for reflection the gingiva surrounding the tooth before extraction. This instrument is considered suitable compared to standard elevator because it is easy to use and has thin anatomical end. The elevator must be used for also after the flap elevators during the surgical procedure. This is elevator. We have two ends. One end is sharp, this for interdental papilla, and other end is blind for elevating the flap. For any surgical procedure, you need the periostal elevator. We have many types. This type, for example, both of them blunt end, but small. Both of them, small end. But this periostal is very large, round end for elevation the mucoperiosteum flap. Hemostat or artery forceps. Sometimes it's said artery forceps or hemostasis. Use it in the oral surgery either straight or curved. The most common used is curved mosquito type or micro Halsted hemostat, which has relatively small and narrow peak, so that the end grasp the vessel and stop the bleeding. Why? Because hemostat توقف النزف, توقف الدم, grasp the blood vessel and stop the bleeding. Hemostat may also use it for grasping the soft tissue and facilitating the manipulation for its removal. The mosquito in the peak is parallel, and inside this is parallel. This is tissue forceps, surgical for standard who Addison tissue forceps. This is long and this is short. This used for posterior region and this is for anterior region. it has peak. This is peak of the forceps has wedge shape projection. Wedge shape projection or tooth on one side. Wedge shape projection or tooth in one side, and receptor on the other side. يعني other side you have depression. In this side elevation and this side depression, which fit into each other when handle are locked. When you lock it, use it. This mechanism allows the forceps to grasp the soft tissue found between peak very tightly, and grasp the soft tissue between them very tightly. We have short and long. The short use it for anterior region and the long for posterior region. This type of the forceps, for surgical forceps, we have peak on one side and depression in other side to grasp the soft tissue between them very tightly. This is same on the previous, but the difference between them, it doesn't have peak at the end. This is anatomical forceps or non-toothed forceps. Also, we have short and long, but doesn't has peak. This type of forceps is used to aid the suture of the wound, as well as grasping small instrument during the surgical procedure. During the surgical procedure, and the difference between this two forceps with previous forceps, it doesn't has peak at the end to grasp the soft tissue. This is used for grasping the suture of the wound, suture during the closure of the wound, and other type for grasping the soft tissue. This is Ronger forceps. Ronger forceps. This instrument used during the intraoral procedure to remove the bone and sharp spiculum. The end and side of sharp blade became narrow. The end and side became narrow, so that when the handle are pressed, they act the bone. When handle is pressed and closed, the bone found between without exerting particular pressure. يعني bone between this area found it without exerting يعني more pressure. There is spring between the handle. This is spring between the handle, which restore the handle to their original position every time pressure is applied for cutting the bone. This is spring at the handle to return this instrument to original position is for cutting the bone when applied the pressure. This is Ronger for cutting the bone. Ronger for cutting the bone, it has spring at the handle between them to make this instrument to go to original position when applied the pressure. This is also for this is bone file. Bone file. This the peak is parallel for smoothing the bone. Just for smoothing the bone, we have two ends, large end and small end, just for smoothing the bone. This instrument has two ends, one small end and other large end. The cutting surface is made up for many small parallel blades, which are set in such way that only pulling is effective. The bone file used in the oral surgery for smoothing the bone and do not remove large piece of the bone. Just this type of the instrument for smoothing the bone. Not you can remove more bone by this instrument. Chisel and mallet. Chisel, this is chisel. Mallet and chakuch. Chisel and mallet are instrument with heavy weight end. يعني mallet are the instrument with heavy weight end. The surface of the end are made of the lead or plastic, so that some of the shock is absorbed when the mallet strike the chisel. By this mallet strike نضرب الchisel. The chisel in the oral surgery used in you have different shape and size. Their cutting are concave. We have two types. One monobeveled, this is monobeveled, or bibeveled. The bibeveled use it for sectioning multi-root teeth. Multi-rooted teeth. This is bibeveled. This is monobeveled, يعني unibeveled. This is mallet, and all of them chisel. Chisel for cutting the sectioning of the tooth. Needle holder. This is needle holder. Needle holder used for suturing the wound. What is the difference between needle holder and mosquito or artery forceps? The end of the needle holder cross hatch, but in artery forceps the blade is parallel. Blade of when grasp the wound, grasp of the artery is parallel. But in this needle holder, the blade is cross hatch to grasp the suture. And how can you grasp? This is the peak of the needle holder. Grasp the suture, يعني needle of the suture. The needle holder peak face is cross hatch, ensuring stability of the needle during tissue penetration. This is the correct position to make the needle holder. Thumb finger inside one ring. The ring finger inside the other ring. The other fingers turn it around this. The index finger near the end to make pressure during suturing. This is index finger are this area, and thumb in one ring and ring finger on the other ring. These two fingers turned around the needle holder. This is correct position to make the needle holder. This is scissor, standard scissor, and Goldman focus soft tissue. Scissor used for cutting the suture. Also, we have scissor types. Blunt end. This is blunt end, and this is sharp end. Also, this is correct position to take the to hold the scissors. يعني thumb finger inside one ring, the ring finger inside the other thing, these two fingers around it, and the index finger on the scissor. This is towel clips. These towel clips used during the general surgery for grasping the sucker or grasping the towel. Towel clips are mainly used for fastening sterile towel and drops placed on the patient head and chest. This is head and chest, and during the general surgery, as well as securing the surgical suction tube and tube connected to the handpiece with a sterile drop covering the patient chest. يعني towel clip most common used for during the surgical procedure. يعني surgical procedure under general anesthesia, not under local anesthesia. This is retractor. Fara beef retractor for retraction of the cheek and mucoperiosteal flap. For the retraction of the cheek and mucoperiosteal flap. And this instrument most common used during the GA. Also, kosher or Langenbeck retractor used as same as our for cheek or mucoperiosteal flap. يعني used for cheek retraction or mucoperiosteal flap. Also, Minnesota retractor for retraction of the cheek and tongue. This is for tongue and cheek. Also, this retractor, Weber retractor, for retraction of the tongue by this side and this end for the cheek retraction. We can use this retractor for retraction of the tongue by this area and by this area for the cheek to side during the surgical procedure. And you have use in two ways, for tongue and for cheek. For tongue and cheek. Or tongue retract, يعني Weber retractor. And bite block and mouth probe. This instrument facilitate opening and keeping the patient mouth open when surgical procedure require for long period and when patient cannot fully cooperative with the dentist. Sometimes patient, you ask the patient, open your mouth, open your patient, not open your mouth. You can use this instrument, make the mouth of the patient open during the procedure. But if you use this retractor for long of the time after the procedure, patient sometimes complain from the temporomandibular joint. It is better patient close and mouth during the procedure to make the problem for temporomandibular joint. And surgical suction. This is surgical suction. We have plastic, metal, and plastic. Plastic is disposable. One time is used, and plastic must be sterilized. There are a variety of design and size of the surgical suction that are used for what? For removing the blood, saliva, and saline solution from the surgical field. Certain type of surgical suction are designed so that they have several orifices. One orifice here and one orifice here, preventing injury to soft tissue during the surgical procedure. The standard surgical suction has main orifice for suctioning. This is main orifice for suctioning, and only small orifice on the hand. This orifice usually covered when rapid suctioning of the blood and saliva solution from the surgical field is required. And surgical suction we have metal and plastic. Metal must be sterilized. We have two orifices, one here and one here orifice. You put finger here or sometimes by the plaster. The plastic suction, one time use and disposable. Also, we have surgical special surgical instrument for irrigation. You can the area irrigate or clean by regular plastic syringe used for same purpose, يعني for irrigation, or surgical special irrigation system for irrigating the surgical field with steady stream of the saline solution. Steady stream of the saline solution. But in clinic, in our oral surgery clinic, specially used plastic syringe for irrigation. And this is the when you take a biopsy or surgery, you need this instrument for it. For example, sucker, towel clip, blade holder, blade, dental syringe, carpool, cover needle, scissor, sharp end or blade end, and periosteal elevator for elevating the flap, mosquito to stop the bleeding, two type of the soft tissue grasping. One end is toothed and other is non-toothed, and this instrument for curate to remove the granulation tissue. This is wronger for cutting the bone. This is a retractor for elevate for retraction the cheek, and this is Langenbein retractor also for retraction the cheek. Suture material, gauze, and this is the periapical curate with end of different size and large end and small end for curating the curate the apex when the soft tissue is present or for granulation tissue is removed. This is the end of the lecture. If you have any question, I am ready. أكو سؤال استفسار؟ هل أكو سؤال استفسار؟